What is transpulmonary pressure? What is pleural pressure? Transpulmonary pressure, PL, is the difference between airway pressure and pleural pressure. Pleural pressure is the pressure of the fluid in the thin space between the lung pleura and the chest wall pleura. It is the force acting to inflate the lung within the thorax. It is the pressure surrounding the lung, within the pleural space. During normal breathing, the pleural pressure is negative, below atmospheric pressure. How do you calculate transpulmonary pressure? Transpulmonary pressure can be measured by placing pressure transducers. The alveolar pressure is estimated by measuring the pressure in the airways while holding one's breath. The intrapleural pressure is estimated by measuring the pressure inside a balloon placed in the esophagus. What is lung compliance? Compliance is defined as the change in lung volume produced by a unit change in transpulmonary pressure. C equals V/P. In clinical practice it is separated into two different measurements, static compliance and dynamic compliance. What is static lung compliance? Static compliance represents pulmonary compliance at a given fixed volume when there is no airflow and muscles are relaxed. During periods without gas flow, such as during an inspiratory pause, patients take breath from spirometer and hold it until transpulmonary pressure difference becomes stable. This is repeated with different tidal volumes to produce pressure/volume curve. It only measures the elastic resistance. What is dynamic lung compliance? It is the continuous measurement of pulmonary compliance calculated at each points representing schematic changes during rhythmic breathing. It measures both elastic and airway resistance. During periods of gas flow, such as during active inspiration. What are the characters of lung compliance curve? The lung volume are taken at specific measured pressure points and then plotted on a diagram. A pressure volume curve representing both elastic and airway resistance properties of the lung. The two meeting points are end inspiratory and end expiratory points, and the line connecting them provides the measurement of dynamic compliance of the lungs. The pressure required to inflate the lungs is higher than the pressure required to deflate them. Surface tension contributes to differences in the shape of the pressure volume curve during expansion and deflation. Curve is also called the hysteresis curve. What factors determine lung compliance? Two factors determine lung compliance: elasticity of the lung tissue, and surface tensions at air-water interfaces. What is surface tension in the lungs? Surface tension in the lung is the force exerted by water molecules on the surface of alveoli as those water molecules pull together. What is surfactant? It is a surface active agent that reduces surface tension of the alveoli and the resulting pressures needed for alveolar inflation. What are the clinical importance of lung compliance? Certain pulmonary diseases can influence changes in lung compliance. Emphysema, the elastic recoil property of lung gets damaged. Because of poor elastic recoil, such patients have high lung compliance. Their alveolar sacs contain a high residual volume. Pulmonary fibrosis, lung elastin fibers are replaced by collagens which are less elastic and decrease the compliance of lung. Is the compliance of thoracic cavity equal to lung compliance? No chest wall has its own elastic and viscous characteristic. Thoracic cavity compliance, lung and chest wall compliance, is lower than compliance of the lung alone because of the opposing effect of the chest wall. Any changes occurring to lung tissue or chest wall elastic force could lead to changes in compliance. Compliance determines 65% of work of breathing. If the lung has low compliance, it requires more work from breathing muscles to inflate the lungs. What is work of breathing? Work is done by the inspiratory muscles and has two components. A. Work done to overcome the elastic resistance, elastic work. B. Work done to overcome frictional resistance, airway and tissue resistance, non-elastic work. Elastic work. This work performed by the inspiratory muscles to overcome elastic resistance of lungs and chest wall. Surface tension of fluid lining alveoli. Resistance work is represented by the triangular area 0 ABC 0. Non-elastic work. Non-elastic work is done to overcome airway resistance. 28%. The greatest resistance is met in the medium-sized bronchi. Tissue resistance, 7%. It is due to the viscosity of the lungs and chest wall. This non-elastic work is represented by the hatched area 0 dBA0. It normally constitutes about 35% of the work of breathing. What is transpulmonary pressure? What is pleural pressure? Transpulmonary pressure, PL, is the difference between airway pressure and pleural pressure. Pleural pressure is the pressure of the fluid in the thin space between the lung pleura and the chest wall pleura. It is the force acting to inflate the lung within the thorax.